Okay, good evening, everyone. I'm Mayor Ted Betancourt, Chairperson of the School Committee. I'd like to call the regular school committee meeting to order. Today is August 24th, 2021, and we are starting our meeting tonight at 7:11. The meeting tonight is being televised live on Peabody Access TV. Real-time public participation can be addressed to the Peabody School Committee utilizing Zoom virtual meeting software for remote access. The application will allow users to view the meeting and make a comment during public participation. And as we have now for a number of meetings, anybody that would like to speak through that access, please raise your hand and we'll make sure you are heard during public participation. I'd like to start off today's meeting with a call to order. And the first, we'd start with a moment of silence. And we had a special dedication of the moment of silence today. And I wanted to turn it over to Mrs. Dunn. I'll turn it to you, Mrs. Dunn.
Thank you, Mr. Mayor. We'd like to ask everyone to keep in your thoughts and prayers during our moment of silence the passing of Despina Embeliotis Tagliamonte Desi. Desi was a long-time employee of the school department. She served for over 25 years as secretary at the Carroll and the Brown schools prior to retiring just a couple of years ago. She was always a lot of fun. She was always smiling, always laughing, and she will be missed greatly. She was a wonderful employee. She really cared about the children and the families at those schools, and she was a great classmate of mine. We graduated together. So she's missed.
Thank you, Mrs. Dunn. So if everybody could please rise with a moment of silence, and then we'll follow that with the Pledge of Allegiance. Okay, please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, thank you. Also, the minutes of our meeting are being taken today, as they always are, by our recording secretary, Leanna Harris. And let's go into the agenda. So next item is the minutes. We do have regular school committee meeting minutes for approval from the August 3rd, 2021 meeting. I'll turn it to you, Mr. Arnottis.
Motion to approve the August 3rd, 2021 regular school committee meeting minutes.
Second.
Thank you. You've heard the motion for approval by Mr. Arnottis, seconded by Mrs. Dunn. Roll call vote, please.
Mr. Huckman?
Yes.
Mr. Olympio?
Yes.
Mr. Mikko?
Yes.
Mrs. Carpenter?
Present.
Mrs. Dunn?
Yes.
Mr. Arnottis?
Yes.
Okay, thank you. Next item on our agenda is approval of bills. We do have two warrants. Mrs. Carpenter, I'll turn it to you.
Thank you. I'd like to make a motion to approve warrant A number 4842 in the amount of $657,961.51 dated August 24th, 2021, subject to audit.
Second.
Okay, thank you. You've heard the motion by Mrs. Carpenter for approval of warrant number 4842, seconded by Mr. Olympio. Roll call vote for approval, please.
Mr. Huckman?
Yes.
Mr. Olympio?
Yes.
Mr. Mikko?
Yes.
Mrs. Carpenter?
Yes.
Mrs. Dunn?
Yes.
Mr. Arnottis?
Yes.
I'd like to make a motion to approve warrant B number 4843 in the amount of $12,432.51 dated August 24th, 2021, subject to audit.
Second.
Okay, thank you. You've heard the motion by Mrs. Carpenter for approval of warrant number 4843. A motion was seconded by Mr. Olympio. Roll call vote, please.
Mr. Huckman?
Yes.
Mr. Olympio?
Yes.
Mr. Mikko?
Yes.
Mrs. Carpenter?
Yes.
Mrs. Dunn?
Yes.
Mr. Arnottis?
Yes.
Okay, thank you. Our next item on the agenda is continued business. We have one item under continued business, and I'll turn it to you, Mrs. Dunn, for an update on the Welch School MSBA project.
Thank you, Mr. Chairman. I think they're having trouble broadcasting our meeting at the moment. We're coming through here, so I don't know. I'll just proceed, and they must be taping. Okay. As far as the Welch School project, we have a joint meeting Thursday evening, the 26th, here at 6:30, and also through the magic of Zoom. It will be virtual and in person. And that meeting is a joint meeting of the Peabody School Committee and the Welch School Building Committee for the purposes of letting all of you see up close and personal the presentation about the Welch School. They're going to, the OPM, the designers, and the construction company have a great presentation for all of us regarding all of the work that they are ready to submit to the MSBA for MSBA approval. As part of that, it requires a vote of the school building committee, and it also requires a vote of the school committee. And that's why we'll be going through 2 roll call votes that evening. This is a really important milestone in the project because once we submit this, we will then get on the agenda for the MSBA October board meeting and hopefully here in November if they approve all of the schematic design. The schematic design is not just the really nice drawings and the floor plans, it includes the budget. And they have been working very diligently to make sure that this comes in on the budget that we've set for the city. They are really amazing with the work that they do and the topics that we discuss, and it's still an incredibly interesting project, and you'll be able to find out about it on Thursday night and actually ask questions if you'd like of the architects, and you'll be able to understand why they did what they did and why they recommend what they did. So we're hoping for a good meeting, and that will be Thursday evening at 6:30 here or virtually. And again, I'm always happy to answer any questions if anybody has any.
Thank you, Mrs. Dunn. Any questions for Mrs. Dunn at this point on that project? Great. I know things are moving along very well, and looking forward to that project at the Welch. Okay, next item is Superintendents Report. Dr. Vidal, I'm going to turn it over to you. I know we have a number of items to discuss.
Thank you, Mr. Mayor. So on the agenda, we're going to go out of order just a little bit, and I know it's on everyone's mind is the return to school. So we had a great day today. We welcomed our teachers back, and we had some professional development. We look forward to 2 more days of professional development and then welcoming our students back on Monday. So we're very excited to start the new school year fully in person and welcoming the students back. We do have some return to school protocols that we'd like to communicate today, and things are ever changing. And then we'd like to hear from our health department, and then we have a few other items on the agenda which we'll get to. So similar to last year, our goal has always been the safe return of our staff and our students to full-time in-person learning. We know that that's the goal. We want to be able to support our students and our staff as we bring them back and really welcome them back into our schools. We had a great end of the year last year. We were able to celebrate some of our graduation ceremonies and our moving on ceremonies in person with our families, and we'd like to do so again. We continue to follow the Department of Education and the Department of Public Health guidelines as we return. We received some updated guidance. So today, Commissioner Riley has mandated universal mask wearing for all individuals in our schools until October 1st. So we are a little bit disappointed in this process. We truly believe in the democratic process, and this body has been very open to listening to our community and to trying to make the best decisions that we can for our community. Unfortunately, this has been taken out of our hands, and it has been a mandate, so we will be following that mandate until October 1st. We would like to hear from our health department, and we'll get some information as we come along. But it's important to know that in this guidance that we got today, that if 80% of our staff and students are vaccinated by October 1st, that then we would be able to remove masks for all vaccinated individuals in those schools. And we do expect that a lot of this information will be coming to us in the month of September, and we will be sharing that out with the community. And I think that as we talk about this, our goal has always been to return to school, but we also want to make sure we're doing everything we can to keep our kids in school. Last year, we had over 1,000 students who were healthy that needed to be quarantined and they missed school. And we know that missing school and that fragmented schooling is very detrimental to our kids and to our families. So there are some new protocols around close contacts and quarantines that we'd like to communicate tonight. There are some exemptions for quarantine. So any vaccinated individual that is identified as a close contact, as long as they're asymptomatic, will be able to be exempt from quarantine and stay in school. Any individual that is masked and maintains 3-foot distancing will be able to stay in school as long as they are symptom-free. And then if you are identified as a close contact, we do have a couple options for families. So if you are either unmasked, say at the lunch table, or if you are unvaccinated and you are identified as a close contact, you could choose a test and stay option, which we will be communicating out to our families. A mask will be required during this time. You know, again, this goes beyond October 1st, but if you were identified as a close contact, you could sign a release form and opt to do a rapid test in the nurse's office, 5 days, 5 consecutive school days, and as long as that test came out negative, you would be able to stay in school. So we're really trying to do everything we can to keep kids in school and to keep them around their peers and around their teachers and continue. We also truly believe that options are important for our families, and so if you do not want your child to be tested, or if an individual does not want to be tested, you could choose to quarantine at home if you are unvaccinated. And so we'd also like to just think about some other things that the Peabody Public Schools can be doing to mitigate spread and to keep our kids in school. We have run vaccination clinics and we'll continue to run those. Last night we had our freshman orientation that was wildly successful. We had a lot of kids, they gave out their Chromebooks and welcomed the kids to school. They got their tours. They also worked with the Public Health Department to have a vaccine clinic in the high school field house last night. And during our back-to-school nights, we'll continue to offer some vaccine clinics for all those people who would like to be vaccinated if you haven't already done so. And you would like to be vaccinated, we'd like to provide that opportunity for you. We'll continue to do our testing at the Higgins. You know, we were working once or twice a month on Wednesday nights where we had a drive-up testing site here at Higgins. We'll continue to do that to make sure we're monitoring the number of cases in our community. And recently we were accepted into the COVID-19 testing program through the state. And there's 2 different types of testing that we can do, and this is all voluntary. But last year, we know that if someone had a symptom such as a sore throat or if they were nauseous, they would have to go home for 48 hours. And a number of our families expressed frustration that healthy kids were going home and they were missing very important instruction. So we are hoping to be able to implement diagnostic testing for any of those individuals, that it would be a shallow swab with consent, and if you had a symptom and you tested negative for COVID-19, you could return to class. This was done in a number of school districts across the Commonwealth last year, and it was quite successful. So we're looking forward to implementing that in the coming weeks, and also the test and stay program in lieu of quarantine, so another option to keep kids in school. And then finally, we're going to continue to offer air purifiers in classrooms for any faculty or staff that is interested in that. We gave out over 100 of them last year. We're going to continue to do that. We're going to continue to encourage hand hygiene and then follow the recommended protocols. Again, we want to give families options. We will be encouraging during the nice weather to continue to go outside. Masks are not required outside, but they are required on our buses and they're required in our nurse's office. And so that will continue, and of course the universal masking has been mandated this year. So with that, I'd like to call up our Public Health Director, Sharon Cameron. She has a presentation for us, and then we'd like to open it up to the board, the school department for comment as well.
Just press that button. The one on the right.
Good evening, everybody, and thank you for inviting us to be here with you tonight. I'm Sharon Cameron. I'm the Public Health Director for the City of Peabody, and with me tonight is our school nurse leader, Brenda Wolf, and Dr. Leanne Mansberger, who is a physician who serves on the Peabody Board of Health. I first wanted to touch on what is the role of the Board of Health in this discussion. Local boards of health play a role in identifying health priorities in the community and promoting policies to improve the health and well-being of our entire community. We pay a particular attention to our vulnerable residents to make sure that they have access to the environments and the tools that they need to support their well-being as well. In times of crisis, boards of health may need to take action to mitigate serious health threats by acting upon the weight of scientific evidence, even when that data is incomplete or imperfect. The Peabody Board of Health joins other community leaders in recognizing the need to maximize in-person learning for all of our students this year, and that's a top priority. And that priority is the foundation of the recommendations that you'll be hearing from us tonight. Thanks. So before I get into data, I just wanted to give you a few of our bigger picture thoughts. And we come before you tonight full of optimism for the success of this school year. Some of those reasons, we are in a much better position now than we were a year ago. Scientists have a much better understanding of the coronavirus and how to mitigate its impact in the community than we did at this time last year. We have more tools available to us now. We have treatments. We have greater access to rapid and reliable testing. One of the most significant differences, of course, is the availability of 3 safe and highly effective vaccines. And those vaccines have mitigated the impact of this virus in our community. They've minimized the number of severe illnesses and deaths we've had. And just as importantly as all of those, we now have a year or more of experience under our belts in terms of how to bring our kids into school and keep them there safely by implementing layers of mitigation strategies. But at the same time, we have reasons to be cautious. Despite all the successes of last year, many students, as you've heard from the superintendent, were deprived of opportunities for in-person learning. We now have a much more infectious form of the virus than we had last year. Our caseloads are increasing. Last year during school, many other sectors of our society were closed. Many businesses had restrictions. Opportunities for gatherings were limited. We are delighted that those restrictions have been removed, but what it means, the flip side of that coin, is that now people have more opportunities to interact with each other and potentially expose each other to illness. We're bringing all children back to school, and that means we have to remove or minimize some of the mitigation strategies that we have known to be successful. And most significantly is the social distancing. We fully support bringing the children back, everybody back full-time, but it does have an impact on the distance we can maintain between students. And then lastly, it's important to remember, not all students are eligible to be vaccinated. The vaccine is not approved for children under 12 at this time. Excuse me. Okay, so I wanted to share some of the local data with you. This is a picture of what the pandemic has looked like in Peabody since March of 2020 to the present. And you can see we had 2 peaks of illness. These are our cases. To date, we've had 7,556 cases of COVID in the city of Peabody. We had our first peak back in the March-April period of 2020, and then another peak last December, and those were really dark days, I think, for all of us. And now we're in a much better place. But you can also see recent uptick in the number of cases that we have, that we're dealing with. One of the important pieces of information I want to share about this particular slide is that back in April of 2020, many of the cases in our community were disproportionately from long-term care settings. In fact, in April of 2020, about 48% of all cases in Peabody were associated with long-term care. But throughout the entire course of the pandemic, long-term care cases only represent about 7% of all cases in our community, which means the other 93% of our cases are acquired in other community settings. This shows you the picture of the average new daily case rate. This is one of the metrics that the state used to develop their color-coded maps that you're all familiar with. This is a way of standardizing rates in different communities regardless of their size. So again, you see we peaked last fall. We dipped down quite a bit over the summer, but now we're ticking back up. And in fact, in the 2 months since June 24th, our daily average case rate has increased 25-fold. You can also, the right-hand graph is the state of Massachusetts. You can see what's happening in Peabody is very closely mirroring what's happening across the state. The other metric that the state uses to develop their color-coded maps is the percent positivity, the percent of the cases that are coming, when people get tested, the percent of those coming back positive. And again, you can see the trends in Peabody pretty closely mirror what's happened across the state. And again, you can see we're on the uptick there as well. In the 2-month period between June and August, as of yesterday, we had a 6.5-fold increase in the percent positivity rate here in the city of Peabody. Tragically, we have had 328 deaths in our community since the pandemic began. And every single one of those deaths is a tragedy. Most of the deaths in our community, as expected, have been among older individuals and people with underlying health conditions. But what I wanted to show you is that we have had deaths in every single age group in our community. One of the metrics that we get concerned about is hospital capacity, because we want to ensure that care is available to those who need it, whether they're suffering from COVID or they're suffering from any other illness that requires hospital-level care. So this is from the state's website, and as of this week, 89% of all the med-surg beds in the state of Massachusetts are occupied. And 76% of all the ICU beds in the state of Massachusetts are currently occupied. In terms of hospitalization trends, these are the number of admissions, and again, you see the 2 peaks from the 2 prior surges, and you can see we're on the uptick again. I know you're particularly interested in the school-age population, so I wanted to show you the breakdown of our cases by age. Back at the beginning of the pandemic, children under 19, it's the dark blue wedge of the pie. Back in April of 2020, they represented 2% of our cases. By December, they represented 12% of our cases, and as of this week, they represent 17% of all the cases in the city of Peabody, and they're actually the largest slice of the pie, tied with the 30 to 39-year-olds. Next slide, please. And this is the graph showing the breakdown just over the past month. In the past month within the city of Peabody, we've had 190 cases. 33 of those cases are in school-aged children. That represents about 17% of all cases. The other interesting piece of this is if you look at the age group of the parents of these children, the 20 to 40-ish years old, those are the other significantly affected populations here. So we're seeing fewer cases in the older population and many more cases in our younger demographics. I don't expect anybody to read this slide, but what I wanted to point out to you is that as imperfect as it is, we do try to capture occupation data for all of the cases, and the largest groups, the occupations are students and children. The other occupations represented on this graph include people who work in healthcare settings, long-term care facilities, service industries, retail workers. None of those industries have anywhere near the prevalence in Peabody as we have had among our students and our children.
If I may just, I'm sorry to interrupt, but you're throwing a lot of data at us. Can we go back to that last slide, Dr. Vidal? This is just people who tested positive. This isn't hospitalization.
These are positive cases, yes, right, not
Your prior
hospitalizations.
slide was about hospitalization.
It was, correct,
Okay.
yep.
Thank you.
Thank you. The superintendent mentioned the impact of children's educational experience being interrupted, and I think this slide really captures that. The blue were the people who were isolated because they were ill themselves. We had 89 staff and 655 students who had to leave school due to isolation for COVID disease or symptoms. But we also had many more people impacted by needing to quarantine. Those are the orange bars, and so we had close to 1,000 students. That represents about 11% of our students had to leave school last year due to being isolated, and over 15% of our students missed extended periods of time, up to 14 days in many cases, because of the need to quarantine. And the other point I'd like to make is many students had to quarantine multiple times. So this graph shows incredible disruption to children's in-school learning experience. And we also wanted to break this down by levels, so you can see the different grade levels were affected. And just the note here is that the impact on the K-5 population, we had 274 cases, and a reminder that this is the population that's not eligible to be vaccinated. So the superintendent talked about the importance of the mitigation strategies, and I did want to touch on them. Many of those mitigation strategies will continue into this year, but not all of them will. We need to continue to promote building sanitation and personal hand hygiene. The improved ventilation is a very significant safety measure we can implement and have implemented. One of the things that's really, really important is that staff and students and anybody entering a school building needs to be screening themselves for symptoms on a daily basis. We don't want anybody coming into a school building who is ill. The importance of cooperating with contact tracing is a really important part of our safety plan. And this was somewhat challenging, in all honesty. Last year, we did not have the level of cooperation in some cases that we needed to do effective contact tracing, and that does put our entire community at risk and also can put the continuity of school operations at risk. Universal mask use was a mitigation strategy last year that certainly supported in-person learning. Physical distancing, as we mentioned, is going to be significantly reduced. The capacity limits that we had last year, the fact that children were exposed to only one cohort, now they'll be exposed to full student bodies. And again, we're glad those things are happening, but they do increase the potential risk for transmission. Testing is an important mitigation strategy, and of course, vaccination for those students who are eligible. Okay, so this is the data on where we stand with respect to vaccination. In the 12 to 15 age group, about 49% of PBD students have been vaccinated, fully vaccinated, and among the high school population, it's about 63%. We still have a lot of work to do to get those numbers higher. We also have disparities in vaccination by race and ethnicity that are of great concern to us. And in particular, I'd like to point out that the vaccination rates among our Hispanic residents are over 10 points lower than vaccination rates in other groups. And again, we have a lot of work to do to build confidence so that people are willing to accept the vaccine. And I just thought people might be interested in the gender breakdown, so I put that in there as well. So next slide, please. I know everybody's heard about the Delta variant. That's one of the reasons why some of these recommendations have been made, because the Delta variant is much more transmissible than the variant we were dealing with when we were in school last year. It's about twice as easily spread. And it's also able to be spread by people who are fully vaccinated. And this really is the foundation for the CDC's recommendation for masking in indoor spaces. The other point I wanted to point out that as recently as May, Delta represented only 1% of all the cases in the United States, and now it represents more than 90% of the cases in the United States. So could we just go back to that last one? So again, it's more than twice as infectious. So many more people are likely to be, who are exposed, are possibly going to become infected. So what are we experiencing here in Peabody with respect to breakthrough cases? A breakthrough case is a case of COVID in somebody who is fully vaccinated. I hesitate to share this data sometimes because I don't want people to misunderstand it and think that the message is that vaccines are not effective, because the vaccines are highly effective in preventing severe disease and death from COVID, but they're not 100% effective in preventing infection with COVID. For the time period between May 1st to this week, 28% of all the new COVID infections in Peabody were breakthrough infections, infections in fully vaccinated people. That's 109 of the 391 cases we had during that time period. The other thing that's significant is, unlike other variants, the Delta variant produces the same viral load in people who are vaccinated as it does in people who are unvaccinated. The difference is that the vaccinated people are able to shed, get rid of the viral load more quickly, so they're infectious for a shorter period of time than unvaccinated people, but they still do have the ability to infect other people. And that's the reason why the CDC has recommended masking regardless of the vaccination status, because people who are fully vaccinated do have the ability to infect others and to be infected themselves. And the this infectiousness is thought to be one of the reasons, I'm sure everybody read about the cluster of cases in Provincetown, and this is one of the explanations for that. So this is a slide directly from the CDC. The fact that vaccines are not available to all children, contact between vaccinated and unvaccinated people. They have recommended universal indoor masking regardless of vaccination status. And CDC has actually made recommendations for the broader community as well, that people, regardless of vaccination status, should be wearing a mask in indoor public settings if they are in an area of substantial or high transmission. Essex County in Massachusetts is an area of high transmission at this point in time, and we have been for at least a week. And I know the school committee has seen the recommendation from the Board of Health, and the recommendation doesn't just talk about schools, it talks about recommendations for other public buildings as well, and that is the reason why is we are following the CDC guidance. I thought it was important to make people aware of the many reputable public health and medical organizations that are recommending universal masking in school. In addition to the CDC, the American Academy of Pediatrics, Mass Medical Society, American Academy of Family Physicians, you can read the list, but these are all reputable associations of public health professionals and medical professionals who value and understand the importance to students of being able to access in-person education, and they feel that this is the appropriate way to proceed to ensure that we maximize those opportunities for kids. The superintendent touched on this, but free testing is available pretty much every day of the week. The state has a few Stop the Spread sites in adjacent communities. We are sponsoring regular events here in the city of Peabody. We have an event here at the Higgins tomorrow night. It's free to all city residents as well as any city employee, including employees of the public schools. And as the superintendent mentioned, we are exploring opportunities to bring rapid antigen testing into the schools so we can assess symptomatic individuals as well as to support that test and stay program so that we can minimize the number of asymptomatic close contacts who would need to leave school. In terms of vaccination, vaccines are free and widely available now. You can get them pretty much at any pharmacy, any primary care office. We've sponsored a number of pop-up clinics throughout the city. There's one tonight in front of City Hall. There's a clinic at Haven from Hunger on a weekly basis. We've been at many of our churches in the community. We've been at every summer concert. We're planning pop-up clinics at hopefully all, but if not, we'll make it happen. If not on orientation night, then other nights, but back to school events. And the state has made mobile vaccination resources available to employers and to homebound residents. So there's plenty of opportunities to be vaccinated. So in summary, I wanted to close reiterating the recommendations we have to support the success of in-person learning for students this school year. We want to continue with the enhanced sanitation, ventilation, and hygiene protocols. We want to reinforce the importance of daily symptom screening for staff and students. We want to really impart upon families the importance of complying with requirements to isolate if they're sick or to quarantine if they're exposed to somebody. We really need parents to cooperate fully with contact tracing, implementing in-school testing options to minimize the loss of in-person learning time. We want to promote vaccination for eligible staff and students. We want to provide distancing to the extent feasible, given that we understand we want to have all kids in school buildings, but we want to minimize potential for close contacts, and we want to require universal masking indoors. All of these strategies together provide multiple layers of protection that we feel are important to support the success of keeping kids in school. So thank you for your time, and I would like to turn it over to Lee Mansberger for a few remarks.
Thank you for your time, and thank Sharon for a comprehensive presentation, so I will keep my remarks short. I just wanted to say that the letter that you received from the Board of Health, 100% of the Board of Health stands behind those recommendations for universal masking when indoors. I know that this has been taken out of your hands at this point until October 1st, but the only other thing that I want to say to you is when you have a problem with your toilet, you call a plumber because they're the expert. I would hope in the future when you have deliberations that are about public health and the safety of the students and everyone in the school environment, that you give serious consideration to the experts, the CDC recommendations, the American Academy of Pediatrics, and your local Board of Health, because we only have everyone's best interests at heart. Thank you very much.
Great. Thank you for your comments. Ms. Cameron, thank you. That was a great deal of information you provided to us. Thank you. I know this is going to be an issue, that we're going to be discussing today, but I think this will be an issue that we're going to be discussing at a number of meetings going forward. So, but that information was important for us to have, so thank you. I didn't know if there's any questions at this particular time or any thoughts that the school committee members wanted to share. Mr. Olympio?
Yeah, thank you through the chair, Ms. Cameron, and your whole team. Thank you for all that you've done over the past 18 months. We appreciate it. A question that I had is, are all of the COVID cases now, are they considered the Delta variant? In other words, how do we know what's, say, normal COVID and what is the Delta variant? Is there any testing that you can determine that?
So the state health department sequences a certain percentage kind of randomly of the cases throughout the state. Not every case gets sequenced, but from the representative sampling they're doing, they have determined that over 90% of the cases in Massachusetts, well, across the country, but also in Massachusetts, are the Delta variant. So there's a presumption that most cases are the Delta variant.
So in other words, let's say the first variant, that sort of died off, and now we're in the Delta stage. Is that a way of looking at it?
It hasn't completely died off. There is a small percentage of cases that are there are several different variants. They all represent a small fraction of the cases, but the Delta variant is the predominant variant. Brenda, did you want to elaborate on that?
When we get positive cases reported through the statewide reporting system, it's called MAVEN, and we have access to those strains, and we have the ability to look and assess as to whether or not it's a Delta variant. But with that being said, there still are all the different strains from March of 2020. They're all still out there. But the Delta variant, as Sharon just indicated, is the predominant strain right now that we're seeing.
And would you say that's the Delta variant for the people that have been tested positive that have been vaccinated, breakthrough cases? Would you say that that's just pretty much all Delta?
A large majority of them,
Okay.
yes.
Okay.
Yeah, because we also have the ability to see the vaccination status as well. So we are able to look at all of those variables.
Thank you.
You're welcome.
Thank you, Mr. Olympio. Mr. Mikko?
Through the chair, just thank you for being here, and thank you for all your hard work for the last 18 months. And I think truly you're one of the reasons why we were able to get through the first wave and open up our schools, open up our businesses and restaurants. And we'll certainly take your what you have to say to heart here. It's important. I did have a couple of questions in regards to cases. Actually, not cases. Excuse me. The K-5 students. Is there any chance? Are we hearing anything about vaccinations coming down, or the possibility for these students to be vaccinated in the future? I know there's been some hesitancy there. Are we hearing anything, or what if you had a crystal ball? Do you think the CDC is going to recommend vaccinations, and or the FDA, I should say, would that be something that we could look forward to?
There are actually clinical trials that are taking place right now in that age population, but they've not come out and gave any indication as to how long the trials will be and when and if they'll be going forward with FDA recommendation.
Okay, all right. I'll yield. Thank you. Thank you.
Thank you, Mr. Mikko. Mr. Huckman?
Thank you, Mr. Chair, through you to Ms. Cameron, Ms. Wolf, and Doctor, I forget your name, I apologize. My apologies. Thank you for appearing tonight and providing us with a tremendous amount of information. Before I get into the rub that Mr. Mikko just identified, I, for one, have a tremendous amount of respect for the local Board of Health. Other agencies that you might have mentioned, I'm not so confident in. If I have a plumber because I have a leak in my sink, I shut off the sink that's leaking. I don't shut off the water to my house. You made the analogy, so I just wanted to respond to it. With regard to the rub that Mr. Mikko just raised, it seems to me that a large reason for the Commissioner's action today and your recommendations is because we have a population in our schools that's not eligible to be vaccinated. And I understand that. However, the Commissioner acted by mandating masks through October 1. There's not going to be a vaccine available to people under the age of 12 by October 1. So if there's no vaccine available to that population, will it be your recommendation on October 1 to continue with full masking indoors? And I know that's a tough question. I don't know if you can answer that, but that's where one of the areas where I have some concerns about the Commissioner's actions today. And again, respectfully, your recommendations are to fully mask through October 1, and then we'll review it. What I'm suggesting is I don't know that the significant component for the rationale for your recommendation, the Commissioner's recommendation, the CDC's recommendation, I don't think anything's going to change in the next 30 days.
I agree that we are not going to be having a vaccine for that age group by October 1. I don't agree completely that the sole rationale for the masking is because it's about increasing vaccination rates. I think part of it is because, as we've discussed, the Delta variant is infectious, and that even people who are vaccinated have the ability to be infected and to transmit infection to others. So I think that's a significant piece of it. And the other comment I would make is that I think you all saw how quickly the data can change. Between May and, August, we went from, 1% of cases being Delta to 90% of cases. I wouldn't want to speculate on what the data is going to look like in October. We monitor this data 7 days a week. This is what we do all the time, and we change recommendations when the data supports it. We have changed our recommendations many times throughout the course of the pandemic to adjust to changing conditions, and we anticipate that we would make appropriate recommendations depending on what the data look like. But projecting that far out is not helpful right now.
No, I agree, Ms. Cameron, and thank you again for your continued candor throughout this entire process. You, Ms. Wolf, and the Board of Health have been completely candid with me, and I think everybody else in the city, and have had a positive effect on our ability to get through part of this to this point as successfully as Peabody has. And even with that, you identified or informed us as to the number of deaths associated with COVID, which is horrible and a tragedy. I'll just ask one more question, and then we'll move on to someone else. But the recent increase of the number of cases, whether it be the Delta variant or others that still exist, has there been any investigation as to the fact that, or the likelihood that people are traveling more in the summer because students aren't in school, and that travel patterns have perhaps allowed for the velocity by which this Delta variant has spread? And I think you mentioned the Provincetown cluster, and I think the Provincetown cluster was mostly comprised of people who weren't from the Cape or even from Massachusetts. They were a large group of people that congregated in a small area from I don't know where, I don't know if anyone knows where, and that's really the origin of my question is there any data that this is, the increase in the Delta variant positive number of cases is contributed to by people traveling?
I didn't bring this slide with me, but we do put a full data set on the city's website every week with our local data, and one of the pieces of that data is people who report a travel history in the days prior to them or the short time period before they became either diagnosed or symptomatic. And most people are not reporting a recent travel history, but that's one of the weaker data points that we don't have complete confidence in. I do think it's, lots of people are traveling this time of year, but I also think that if you look at the CDC's map of transmission rates throughout the United States, it's a blanket of red. Most communities in most counties throughout the United States have high rates of transmission at this point in time. So,
I will add, in the last couple of weeks, the bump in the pediatric age, so I focus in on that group for obvious reasons. So I look at that, 5-year-old to 18, 19-year-old group, and that there's no travel associated with any of those recent, within the last 2-week bump in cases that we've seen in that age population. It's been more just community transmission.
Thank you all again.
Thank you, Mr. Huckman. Any further questions at this time? Mrs. Dunn?
Thank you, Mr. Chairman. And Brenda and Sharon and Dr. Mansberger, thank you very much, not only for tonight, but for all the work you've been doing throughout the entire pandemic on behalf of the city and behalf of the schools. I was thrilled to hear your analogy, Doctor, when you spoke about plumbers. And I'm going to tell you a funny story. My father came into a gathering of me and my fellow law school graduates. We were all really very happy to have graduated, and everybody had a great job. And my dad needed someone to help him with some plumbing at the house. My dad's a welder. And he asked the group, he says, does anybody know anything about septic systems? And they said, no. He said, okay. He left the room. A little while later, Dad came back and he said, I'm so proud of all of you. You're going to be wonderful attorneys, and when someone needs a good lawyer, they need you. But always remember, when they need a plumber, they're not going to call you, and you don't do anything to them. And it's true. And I say that now because I want you to understand why I am so grateful. Throughout this entire process, I have been calling Sharon consistently with any of my questions about any of the things concerning our schools throughout this pandemic, and I have received complete professional responses. You've been able to explain things to me, Sharon, and that has been so beneficial for me personally in being able to understand all of the pieces of this situation and to be able to make good, informed decisions. I want to thank you for the letter that you sent to us. This is the most up-to-date information that I have found, and all of the links in that letter that you provided are right up to the minute, or they were as of August 11th, and I know this thing changes instantly. But I appreciate that because I was able to read this, hear about the issues going into this coming fall, and look at all of those sites that you put in for links, and it's been very, very helpful. We would not have been able to open school, as Mr. Mikko said, without your help and guidance. And I just want people to understand how grateful we are for the work you do and how impressed I have been with the amount of research that you have all done to protect us and to inform us. This presentation was wonderful. And I would like to ask that we put those slides on our school committee, our school department website so that people in the public could refer back to them. Those are really, really very good, and I want to look at it again myself so I can understand more. But I'd also like to ask if this letter that you sent to us from the Board of Health, if that could also be there, because those links that you provide in here are really, they're vital for us. Going forward, there are going to have to be more decisions being made, and I know October 1st, for whatever reason that date was chosen, I have no idea. But we've been through this now for, 18 months. We know that the situations change rapidly. We're not an isolated community. This is affecting the world, so whatever happens in the world affects Peabody, even though we are the center of the universe. But it does come back to the day-to-day operation of our community. And if the only way that we can get our students into school every day is to require people wearing masks until we can get over another surge or another hump with this pandemic, then that's what we need to do. I trust you, and I thank you for that information.
Thank you, Mrs. Dunn. Mrs. Carpenter?
Thank you. Sharon, Brenda, Doctor, thank you very much for being here. I appreciate all the hard work. I know it's been a very long year and a half for a lot of people, especially for your department, and I appreciate all of the work that you do. With that being said, I will just let everyone know that, this evening I was definitely prepared to come into this meeting to vote on whether or not we were going to be ourselves mandating masks, and I do think it's unfortunate that Commissioner Riley has taken that from us, because I think we're not the same as every other community. One of the things that I did notice during Dr. Vidal's presentation, I heard you say masks will not be required outdoors for our students. So with that being said, in regards to sports, our sport teams that practice and play outside, they won't be required to wear a mask?
Correct. So any outdoor activity right now is not required to wear a mask. It's only indoor activities. That would include volleyball, which is indoors, but for our outdoor sports, masks are not required. We're also encouraging our schools to have recess outside, to have phys ed outside if possible, for teachers to bring their classes outside, to do lunch outside, and at that point we could have mask breaks and kids could remove their masks, teachers could remove their masks if they're outside. They could also distance, even though there are not distancing requirements this year as we return to school, they would be able to have more distance if they go outside. So this mandate is only for indoor at this time.
Indoor, okay, great. And we have all of our tables set up properly as they used to be in the cafeterias. There's no more desks in those, is correct? There's no distancing. We're not going back to any of that, right? Okay.
That's correct.
So just my understanding at this point in time is this is something that we'll end up taking up again in October, pending that there's no other DESE mandates, that this board will take this position up again in October. I would expect that we would hear from Ms. Cameron and her team as to where those numbers fall to help us make that proper decision. But thank you very much for your information. I do appreciate it. Thank you.
Great. Thank you, Mrs. Carpenter. Mr. Arnottis?
Thank you. Sharon, Brenda, Dr. Lee, thank you all for being here tonight. I don't know what we would do without you as a city over the last 18 months if we didn't have you, honestly. We're incredibly grateful, and I hope you guys know that. I don't think you get accolades enough, frankly, for what you guys have done and helped us through. You know, the analogy, I think, hit the nail on the head, frankly. I say that all the time, and I wasn't, quite frankly, terrible. I'm never afraid of a vote here. That hasn't concerned me once, but I'm pleased that we didn't have to make this call because we're not, some rural community. We're an urban community. We have a mall that people come from all over to. We have thousands of students. It's a very transient community. And I think this mandate is, for the time, it's for the month. We'll see what comes in October, and if that's a discussion we have to have, we'll have it. But again, you guys are the experts on this. Dr. Lee, you're obviously a doctor. Sharon, I believe, I think you have a doctorate in public health. No, master's in public health. But either way, you guys are the professionals. This is your living. This is your day-to-day life. You spend more than, quite frankly, a half an hour on Facebook looking at, nonsense science to present to us. So, I think you guys know the facts better than most. And I have no problem saying that I didn't run for a seat on a school board to make a public health decision. And I don't think most people do that. So thank you for what you do. And as far as I'm concerned, if we have to wear masks for a little while longer and contact trace just to keep the school open and make sure that we're in 5 days a week and we're not keeping kids at home and they're getting the education face-to-face to their teachers in their classrooms with their friends, I think that's a pretty reasonable thing to ask for right now. So thank you for what you do, and keep up the good work, and I look forward to hearing whatever updates we have on our numbers if we have to have this discussion and make this decision here in a month or so. So thank you so much.
Okay, thank you, Mr. Arnottis. I anticipate that there'll be a number of discussions going forward. This is going to be a major issue pretty much at every meeting, I think, going forward. So I anticipate that we'll be looking for some additional data from all of you probably in our second September meeting as we go into that October 1st date. There was a question from a resident, and I didn't want to get it wrong, so I asked Mr. Mikko. Mr. Mikko, can you ask the question?
Sure, through the chair to Ms. Cameron. In regards to the vaccinations, I guess the question was, if they're not 100% effective, then why would we be able to unmask our students and our staff if we had an 80% vaccination? Is there any guidance to that? Again, that's from a resident.
Yeah, I'm not really privy to what data went into the deliberation that led to the commissioner's decision. I think that we will continue to have concerns about the potential for vaccinated people to spread and become infected. I think the rationale is that people who are vaccinated are very well protected from having a severe outcome. So I imagine he was balancing the benefits of being able to have the freedom from a mask versus, the risks that somebody would maybe be able to transmit disease, but, somebody who might be exposed to that would have a mild case. But I'm only speculating about his decision-making process, so I don't know, do you want to elaborate? Okay.
Thank you, Ms. Cameron. Mr. Mayor, I just had a couple of things, if I could.
Yes, absolutely, Mr. Mikko.
Sure, and
Oh, wait, hold on one second. Some additional information.
I think they might have been thinking about herd immunity as well. As you know, it's different for different illnesses, and we're still learning and gathering data for this. One of the latest things they had in JAMA was that because Delta is much more transmissible, it may be upwards to like 85% for herd immunity. So again, we're just speculating. We don't know what the Commissioner Riley was where he was getting the information or how that decision was made. But I think it's multifactorial, but that could be part of it.
thank you, Doctor.
You're welcome.
Mayor, if I may, through the chair of the committee, and Ms. Carpenter brought this up earlier about she was prepared to vote. I guess I was as well. I'll be honest with you, though. I'm so very torn on this whole mask issue. You know, after hearing a lot of what's been said tonight, you know, I am concerned about the kids under 12. You know, I'm concerned about the hospital beds being taken up by mostly people who are unvaccinated. You know, I think it's 90% of COVID cases in hospitals are by unvaccinated people. I'm concerned about the businesses. You know, you know, especially the ones downtown here in Peabody. I was down there February of 2020, and you couldn't find a parking spot. You couldn't get a seat at a restaurant. And then we saw all those challenges. So I'm concerned about them. I want to see them succeed. Again, I'm concerned about the restaurants. So I'm very torn on masks. I really am. Every time I speak to someone, I think I'm leaning one way and I lean the other, and it's just so hard. And to Mr. Arnottis' point, I never thought that I'd run for school committee and be on the public health end of this. But I just want to thank you again for all you're doing, and hopefully we can get through this, and you know, we can have a meeting at the end of the year and think about our successes. So thank you for being here.
Okay, thank you very much for being here. I imagine we'll be seeing you again soon on this. Thank you. Okay, I wanted to go back to Dr. Vidal's report. I know he has a couple of other items. Then we're going to go to public participation. I know we have some folks here that would like to speak, and I know there's some people listening in as well that would like to be heard. So I know we have a couple of other items.
Just a couple quick items. Thank you, Mr. Mayor, and I'd like to just thank our friends from the Public Health Department and the Board of Health for coming in. They've been great partners, and they're really essential to the work that we do. You know, as we move forward, we are planning to try to, you know, bring back kids to school as swiftly as we can, and really get the experience of being in school as consistent as it was prior to the pandemic. And so we're required to wear masks as we return. We want to make sure that the other activities are back and they're running full force. So we do have a couple other items on my agenda before we get to public participation. One of them is Citizens Inn is running a backpack program, and they typically host an annual back-to-school drive. This year they purchased over 500 backpacks for students in need, and this program is fully funded by community support, and they are looking for some donations, which can be made by visiting citizensinn.org or calling 978-531-9775. And I do know that Mr. Mikko would like to speak on this as well.
Thank you, Dr. Vidal, through the chair to the committee. The other part of this pandemic, we saw, unfortunately, really hit our younger community, our kids the most. Isolation, food insecurities, and in some cases, homelessness. I had reached out to Corey Jackson, the executive director of Citizens Inn, to see if there is anything we as a community could do. As many of you know, it's an incredible organization that gives back to mostly children and women, but to our whole community, especially in regards to food insecurities and homelessness. Corey Jackson was going to attend and speak on behalf of this backpack program. He could not make it, so he sent over a letter that I just wanted to read to the community and to the school committee. It states, Peabody School Committee members, we at Citizens Inn would like to thank the school department and No Child Goes Hungry for their partnership over the last 18 months. The pandemic has been difficult on all of us, but especially for those whom we serve at our Haven from Hunger location. Partnerships like the ones noted above allow us to reach the most vulnerable in need who are facing food insecurity. The summer months are especially impactful as we provided lunches to children in Peabody ages 2 to 18. This free program has grown exponentially over the years and was especially necessary last summer as we served over 10,000 lunches to Peabody kids who are at home and unable to attend campus due to COVID-19. This summer, we prepared and distributed an average of 250 lunches per week over the course of our 10-week program, which ends this Thursday. Though a significant decrease from last year's numbers, this means that more children are in camp and enjoying their summer. As kids across the North Shore prepare to go back to school, we've been able to supply those children who access our services with backpacks and supplies. For many years, Citizens Inn has hosted its annual back-to-school drive. As COVID-19 continues to impact our daily lives, we decided to forego our summer-long drive. Instead, at the beginning of August, we purchased over 500 backpacks for children in our shelter program and Peabody families who access Haven from Hunger services. In a normal year, we would have been able to get all of those items for free through a coordinated drive with corporate partners, but instead it's an added pandemic expense. We are asking for your support in the form of monetary donations. Please visit the giving page on our website at citizensinn.org to sponsor a backpack and supplies for a child in need. This is the most convenient and safest way to support our version of this backpack to school drive. And a big thank you to the school committee for allowing us the opportunity to be heard this evening. And a big thank you from the families and individuals that use our services. Many thanks, Corey Jackson, Executive Director. Thank you.
Thank you, Mr. Mikko. On that item, Mr. Huckman.
First thing I'd like to do is make a motion to receive.
Second.
Further motion by Mr. Huckman to receive the letter from Corey Jackson, seconded by Mrs. Dunn. All in favor? That's a vote. Mr. Huckman.
Thank you, Mr. Mayor. Through you, Mr. Mikko, thank you for bringing this to not only our attention, but the community's attention. And you did a terrific job describing one of the greatest functions of Citizens in Haven from Hunger. But I just want to emphasize to the degree that they perform their work. It's the dignity by which they perform and provide to their clients that really makes Corey and his team stand apart. Everyone's welcome at Citizens in Haven from Hunger, no questions asked about anything in need, whether it's children under 18, whether it's single parents, whether it's someone that's just in need of a arm around their shoulder and a warm meal and a conversation with another human being. It's a wonderful organization, tremendous board of directors that does a great job over there also. So I just wanted to piggyback on a little of a few of the compliments that you raised. If I can take this to a kind of a 45-degree turn, Citizens in Haven from Hunger has done a great job in picking up the summer lunch program over the last couple of years. Summer Eats has been a successful program because of the way in which they conduct themselves over at Citizens in Haven from Hunger. They've taken the program from a stationary site to mobile sites around the city, which I think has allowed for more students to be able to participate and receive nutritious food on a daily basis. This effort, it's always been my opinion, is the responsibility of the school department. These are our children. These are children that we care for, some of them 12 months a year if they're in special education or in athletic programs or things along those lines. I've had many conversations with Mr. Jackson about this. I've had conversations with Dr. Vidal and his predecessors about this. I truly believe that we should, as a school department, take this endeavor on beginning next summer. It's something I'd like to see on our agenda. It's something I don't even think we need funding for at this point, because the federal government either, I know that they've extended free food through December of this year. I have the impression that that may get extended through the school year with the recent data that we've received in terms of COVID and things along those lines. But if we can put this on the agenda, maybe get food services, Maureen involved in the conversation, and some other people who would need to be involved, I would appreciate that.
Thank you, Mr. Huckman. Very well said. Okay. Turn it back over to you, Dr. Vidal.
Thank you, Mr. Mayor. The next item is school handbooks. So each year, families sign off on the student handbooks at the elementary, middle, and high school levels. Copies of this year's handbooks are available in our school committee packets tonight. They're in draft form until they get voted on, as well as on the district website, which we'll have up there. Once approved, they will be in multiple languages. A lot of these are very dense, long, documents, over 100 pages, because they contain all of the policies. And it's important to have those all in one location on our website that they can be searchable. So they are searchable for our families. So it is a lot of information, but it is important information to have all our policies in one location. One new addition this year that I would like to highlight: at the beginning of every handbook this year, we have a homeschool communication guide. A lot of people, especially on this committee, have been asked, who do I contact for certain things? If I have an issue with this at the high school level, who should I go to first? And it spells that out, and it provides contact information for the various people. So we'll continue to update that each year, but we thought that that was something that we wanted to include up front. I'd like to thank Dr. Chase for organizing that effort. She reached out to a number of different districts that had similar things, and we adopted one for Peabody. So that is at the beginning of each handbook. So at this point, if there are any questions, we could entertain a motion to approve the handbooks and post them on the website.
Motion to accept and approve the handbooks for the 2021-2022 school year for the elementary, middle, and high school.
Second.
Heard the motion by Mrs. Carpenter for approval, seconded by Mr. Arnottis. On the motion, Mr. Huckman?
Very quickly, if we can just include that amendment, I think it's just at the elementary, and maybe offer community service to any students who are willing to give a Cliff Notes version of the handbook. So.
Thank you. Roll call vote?
Mr. Hockman?
Yes.
Mr. Olympio?
Yes.
Mr. Amico?
Yes.
Mrs. Carpenter?
Yes.
Mrs. Dunn?
Yes.
Mr. Arnottis?
Yes.
Okay, thank you, Mr. Mayor. The next item is, this year, believe it or not, is the 20th anniversary of September 11th. And so we would like to partner with our high school and some of our community members who have been very influential in our September 11th celebrations and our remembrance. And this year at the high school on Saturday, September 11th, we'll be hosting a memorial ceremony at 10 a.m. At the Barbudo Memorial located at PBD Veterans Memorial High School. We are going to do this on the Saturday, September 11th, so that members of the community can come and gather and remember September 20th. I'm sorry, remember the 20th anniversary of September 11th. So I know a couple members wanted to speak on this as well.
Thank you, Dr. Vidal. Open up to Mr. Amico.
Thank you, through the chair. And I just wanted to recognize former and retired Peabody teachers Jerry Hallinan and Jean Marchetti, who really have spearheaded this group to make this happen on the 11th of September, on the 20th anniversary. And if I could, the mayor's office and Dr. Vidal, if your office could coordinate and get in touch with, I know Mr. Hallinan and Ms. Marchetti would like to be a part of it, because they've done so much work and they're just valuable people in our community, and again, former educators who have always been there for our kids in our community. So thank you.
Thank you, Mr. Amico.
Absolutely, and it is typically year after year, it's such an important day of remembrance in our community and across the nation. But this year in particular, as the 20th anniversary, we wanted to do something special. So we do look forward to partnering with our former teachers and our current staff as well. And the final agenda item tonight is our Career and Technical Education Skills Capital Grants. This year, we had the honor of Governor Baker coming and recognizing our programs. And I just wanted to reiterate, in 2020, we received $175,000 for upgrades to our culinary arts and our electronics and engineering programs at the high school. And Governor Baker came, and he was met by a number of our students, and they gave a quick tour to the governor and his team, and he was really impressed at the partnership that we have with RCN in terms of fiber optics and in the robotics that we have going on. So you can see he's got some drones in this bottom picture, and one of our students was describing the different functions of the drones. Our instructor is now registered as a pilot. He got his pilot's license, and we have some great things that we'll be bringing down to the Higgins Middle School as well, and we'll have our high school kids working with middle school kids with our drones and with some of the other opportunities that we have. So really a lot of exciting things happening in our culinary arts department and our electronics and engineering. And we're also very excited that at the meeting, the governor did present us with another grant for this year, for 2021, for $125,000 for medical assisting. And, that's going to go to expand that program and give our kids more opportunities. Last night, we had a number of our medical assisting students volunteering and helping at the high school for freshman orientation and as part of the vaccine clinic, and they were really instrumental in the work that we do. So these grants go to fund improvements to our existing programs and really expand the opportunities. So we're very thankful for the governor for coming and doing that presentation at Peabody High School and really being able to meet our students and learn about our programs. So we got some nice articles written in the Lynn Item and in the Salem Evening News, and we did post some of that on our website. So very excited about the work that is being done, and excited for the grant that's coming up so we can expand that program as well. And with that, that concludes the superintendent's report for this evening.
Great. Okay. Thank you, Dr. Vidal, all that information. I want to now go to public participation, and I did want to say a couple quick things before we open it up. I know we have some folks here and that would like to speak, as well as some people online. I think we all had come to this meeting preparing for one thing, and then the rules changed on us. And I know this issue has generated a great deal of emotionally charged feelings. I have 4 children in our public schools. I have one in elementary, one in the middle, and 2 at the high school. This is certainly something that is extremely important and something that I've been doing a great deal of research on. I know all of us have been. The decision today made by the Department of Education and Secondary Education, DESE, took away our local authority, took away our ability to vote on this. And as Mrs. Carpenter said, I think we know our city as well, or if not better than anybody. But DESE is our state agency that has regulatory authority over our school operations. We have to abide by their decisions. I know it's till October 1st. We'll see how these how things develop here, and I have a feeling that this will be back in front of us certainly later in September as we approach that October 1st date. I think this is something that we're going to be continually working with. But I did want to make sure everybody's aware of what our limits are here. That was taken away by this decision by DESE. So I wanted to open it up. I want people to get their thoughts and share with us their feelings on this, because I do think this isn't going to be finalized in this particular meeting. I think there'll be a number of meetings where this issue is going to be taking place. So I wanted to open it up. I know we have some folks here. Anybody that would like to come forward, please come and take a seat at the microphone. And I'm supposed to keep it to 3 minutes, but certainly I'm going to be flexible there in terms of making sure everybody's heard. So please, sir, if you could just, I think it's the second, the button on the right, and you press that. If you can just introduce yourself and give us your thoughts.
Sure. My name's Tim Avrulis. I grew up in Peabody for the last 30 years. My family's been here for 5 generations now with the birth of my son. You're right, this is an emotionally charged subject. We're having mandates passed down to us by officials that we haven't elected. And really the parents' sovereignty to look out for their children and consider the facts and make the best decisions for their children is being stripped from us. There was extensive information provided tonight. However, there was really not much context. And context such as failing to provide an argument for the efficacy of masks in preventing the transmission of COVID. There's actually lots of information out there now available to contradict the use of masks as an effective intervention. Context such as the elderly being the most vulnerable population to severe cases caused by COVID, and their cases being now seen as one of the lowest rates. I think that should be seen as a success, and there should be emphasis on things like that rather than how we can impose further restrictions on our kids who are the least at risk for severe cases. Context such as since the onset of COVID back in March of 2020, 78 million kids in the country ages 0 to 18, there have been 361 COVID-related deaths. And of course, every death is a tragedy, which I agree. But they failed to meet the 477 flu deaths in the flu season of 2018 to 2019 and the 643 deaths the year prior to that. Flu being a more prevalent risk in our community. And the hospitalization trends also follow that track. The flu has been seen as a more dangerous virus than COVID has. And those are statistics provided by the CDC. The presentation that was provided just now was reliant heavily on CDC information. And so I think that some of the information was really cherry-picked, and we didn't have a full outlay of what really is available to us. Aside from that, speaking as a parent, I'm more fearful of the mandates being imposed upon us rather than the actual risk of the virus. And I think we've seen a really dangerous precedent set here where our autonomy as citizens is being stripped of us on a day-to-day basis. And I know that the vote is now not in your hands, and so now the autonomy and the sovereignty of our elected officials is being stripped as well. So I think I'm going to leave it at that. Thank you.
Thank you.
This one here?
Yeah, it should, I think it's still on. Oh,
Still on, okay.
yeah, there we go. Welcome, and if you could just please
Hi.
introduce yourself.
Thank you for having me. My name is Lisa Hayes. I grew up in Peabody. I am raising my two children. One is in pre-K and one is going into the second grade. Thank you for allowing me to be heard today. I was hoping to share some information and numbers of studies and articles that prove that there's no science behind masking children. In light of today's decision from DESE, my speech has changed a bit. I hope you all took the time to read my email and review the references that I have listed. This fight feels like an uphill battle. We just wanted our rights back as parents to make the choices that were best for our children. We're now 18 months into this pandemic, and while Massachusetts has the second highest vaccination rates in the nation, our kids are suffering every day. Mental health among children under 18 has grown 10 times the national average. It seems that we can't look past COVID and see what it is doing to our children and our community. Is COVID really the only thing that exists? We need to do better for our children. So now we're forced to mask K through 12. What does this mean for our 3- and 4-year-olds going into preschool? Do they also need to be masked? The World Health Organization recommends masks for 5 and above. Will our children be able to take their masks off at their desks, just like at a restaurant filled with people? Were children struggling with Will kids struggling with their speech be exempt from the masks? What about children that have asthma and find it hard to breathe? And will kids be disciplined for not wearing their mask correctly? Because this did happen last year. Let me remind you that it's not the job of our children to protect adults. And if we can't take the masks off now, then when can we? I understand that the Department of Education has called for a mask mandate until October 1st, but Peabody has the opportunity to be a leader in taking steps towards providing our students with the educational experience that they deserve. Thank you all very much.
Thank you, Lisa. Anybody else who'd like to come forward? Welcome. If you just please introduce yourself.
Hi, my name's Kristen. I am a Peabody resident. I grew up here. I have 3 children. And I just had questions that I know you guys won't be able to answer. I wanted to ask the health department, but they wouldn't let us address them. So I know that they've been talking about the 80% vaccination rate, and that if the community is 80% vaccinated and herd immunity is reached, then people can take their masks off. But I'm wondering about natural immunity, people that have had COVID and recovered, why those numbers are not being addressed. Why can't people get a titer to show that they've had COVID? And what are the reinfection rates of people that have had COVID already? I feel like this isn't being addressed anywhere, and I just don't know why. And I also wanted to know what happens if kids come to school not wearing a mask and they cannot tolerate wearing a mask. I did see that the recommendations stated that there would be exemptions for people that have medical or behavioral issues, but who is going to decide whether that medical or behavioral issue is enough that the kid cannot wear a mask? And then will the teacher be coaxing them to, be mask training at home, or will the kids be encouraged to put a mask on regardless because people are fearful?
Thank you, Kristen. All very good questions. If you could, I know Lisa sent us an email, which was terrific. If you could maybe reach out, our email addresses are on the city website. You can send a message to me and to Dr. Vidal, and I think we can maybe try to help get that information for you.
Okay, thank you.
Okay. Thank you.
Awesome.
Is there anyone else that would like to, Mrs. Dunn?
Just a brief note. Normally, we require people on public participation to provide their full name and address, and I know in the past I myself have responded to people who have spoken, and I think other committee members do that as well, but just another suggestion.
Thank you. Anybody else would like to come and speak? Yep. Oh, come on up. Okay. Welcome, and if you could just please introduce yourself.
Yep, Ashley Jesus, I live on Smith Ave. I'm a lifetime Peabody resident as well. I just had a question about the policy on vaccinated not having to quarantine. If they can get and transmit the disease, why are they exempt from quarantining?
Yes, another good question. Ashley, can you please email me? I can get you that answer. That's a good question.
Thank you.
Thank you. Okay, anybody else like to speak? We'll go to online. I know we have a couple of people that would like to speak.
Yes, we have two people. The first one is the initial J, Martin, last name Martin. And if you can. Okay, you can unmute yourself and please state your name for the record.
Good evening, can you hear me?
Yes, we can.
Hi, thank you so much. My name is Jay Martin. I'm up on Testinas Ave, right off Jenny and Bartholomew. I had a quick question, Mr. Mayor, with respect. I apologize. I came on a little late as I got home from work. Was there any answer to how many air changes per hour our school systems provided to the children?
Do we have that information?
It's on our website, but we can get it if you send me an email.
Okay, go ahead.
Thank you, Mr. Martin. I believe that information is on our website, but if you send me an email, I can send it to you directly.
Yes, so thank you so much for that. I do have a couple quick points. I wanted to just see if that was out there. The first one, as I was listening to the Board of Health members, there was a question by a gentleman about can the testing be specific to Delta? There was a lot of broad answers on that. I think we do know with Health and Human Services, for one out of Texas, even confirmed that a viral test, either nasal or throat swab, cannot detect if you can detect if you're positive, but it is not known, or the test is not designed to tell you which variant you might have that you're infected with. With that said, do we know what the numbers are, and if Massachusetts even has the labs to detect the coronavirus complete set of genes and searches for new mutations and known variants out there? Because the way they were phrasing that question of the known is it a Delta case? Is it a COVID-19 case? It was very broad. It was more of a suggestion of they were looking at the case size and they would kind of see how many we had, and we were kind of alluding to this number. That was one point. Also, with the Washington Post was cited from Dr. Fauci at a recent Harvard forum. He was speaking about how easy it is with ventilation, to dilute the air quality, getting proper ventilation through there. That's why I did ask that question on the air changes per hour, and I appreciate you answering that very quickly for me. I will look that up. Ford published scrappy filtration kits that were designed, 20,000 of them to be specific. They were donated to schools. What it does is it actually creates a massive filter in the air using at least a MERV 13 filtration unit. Have we talked about operating with some of these devices in the school to help filter out the rooms, to really add very large circulations per hour to dilute that air and any droplets that could be circulating for a child that potentially could be infected? And if you want to cite that, that's also in the Physics of Fluids, and it was part of Science Daily by the American Institute of Physics. And with that, I will step back.
Okay, thank you, Mr. Martin. I also encourage you to email or call our office if you'd like to discuss this further.
Yes, sir. Thank you very much.
And the next person that we have that would like to speak is Brittany. And Brittany, if you could unmute and state your name for the record, please.
Hi, Brittany DeGangi, 1 Bay State Boulevard. And I wanted to give my thanks to the Health Department for their evidence-based recommendations. I think it was met with a little bit of sarcasm, which is disappointing to see, but I really appreciate their efforts. And a couple of questions that I hope you can clarify before school opens is if there'll be any distancing at lunch and snack times for the elementary schools. And there was some discussion, you were talking about the mandate, that the mandate would end October 1st. But it was my understanding, and I could have entirely misinterpreted this, that the mandate doesn't end October 1st. It's just that if the vaccination rates meet the 80% threshold, then they could be taken away for the middle and high school, but that it would still stay in place for the elementary school. And that's it. Thank you.
Yes, Brittany, that's my understanding right now of what was voted on and mandated today by DESE. I imagine there's going to be a great deal of discussion as in these weeks ahead, but I believe that was the vote that was made today. Do you have any information on that first point? Yeah.
Yes, I believe that the school principals will be getting out that information regarding lunch and snack. And, again, I encourage each of these people to reach out to me via email, reach out to the school principal. We're happy to continue these conversations within that forum, and we'll try to get as much of that information out as possible. I do know that we are expecting more information to come out before the October 1st deadline about how we're going to proceed, and we will bring our health department back and discuss that here on the floor.
All right, thank you, everyone. We'll go now. We do not have any written communications today, so we'll go to our subcommittee reports. Education Subcommittee, Mr. Mikko.
Nothing to report. Thank you.
Okay. Finance Subcommittee, Mrs. Carpenter.
Thank you, Mayor. We have a couple of items. I'd like to defer to you for a moment on the contract negotiations.
Thank you. We did reach a memorandum of understanding agreement with Unit A, who is our teachers, Unit C, our paraprofessionals, and Unit E, which are our librarians. We have signed a memo of understanding to agree to a one-year continuation of our existing contract, which means that that contract will continue for September 1, 2021 till August 30th, 2022. It was a 2% increase, and for the paraprofessionals, it was a $1 per hour increase. Everything else remains in place, and we would take up negotiations on a more traditional 3-year contract after a few months. We thought that this was, I'll speak for myself, I thought this was the right road to take at this particular moment. It's a little different than we've done it in the past, but these times are different certainly than they have been in the past. And in speaking with the union representatives, union leaders, and I want to thank and recognize Mary Henry, the former president of the Teachers Union, and Eric Blake, the now president. They've both been excellent to work with in trying to come to this agreement and work on some of the issues that are affecting our teachers and paraprofessionals and librarians. We believe that the focus right now needs to be on opening up our schools, getting our students and teachers settled. We have a number of issues. Obviously, we've been discussing a number of those issues this evening. We have a number of issues that we're going to be tackling on a day-to-day basis, and that the focus for everybody can be on doing the very best we can to make our school opening a success. We also, as a committee, wanted to show our respect and appreciation to our teachers, to our paraprofessionals, our librarians, for the hard work under extremely difficult and challenging circumstances. They've certainly been much more than educators during this particular time in our history, during this COVID pandemic. They've been counselors. They've been working with our students and our families to try to do the very best they can and guide them through these difficult days. And we wanted to show our respect and appreciation and admiration for the work that they've put forward, and we wanted to have a contract in place for them before going into the new school year. We did not want to have, we did not want to be out of contract as we opened up the school year. And I think we all felt that was important for our Unit A, Unit C, and Unit E members. So that was a big factor in this. There's a lot of issues that we're going to be tackling in the months ahead, a lot of things that are going to be subject to negotiations once we get into those. But those were the key factors, and I wanted to ask for a vote. I know we had a vote, Mrs. Carpenter, you'll mention in a moment, and I wanted to have that full vote to approve this memo of understanding and approve this extension of our contract. My understanding is that it has been ratified by Unit A, Unit C, and Unit E members, and a vote today would put that in place moving forward. And I recommend it, and I think it's a good decision for all of us.
Thank you, Mayor. Well said. And I will move forward with those ratifications, and I do wish our staff and teachers and paraprofessionals and everyone in our school buildings a wonderful school year. We're looking forward to it. I'm happy that this is one less thing that they have to consider at this time. We will enter into negotiations probably after the holidays, so I wish them all well. And with that being said, I'd like to make a motion to ratify a memorandum of understanding for Unit A, our teachers, for the 2021-2022 school year.
Second.
Thank you. You've heard the motion by Mrs. Carpenter, seconded by Mr. Olympio. Any comments? Mr. Mikko?
Sure, through the chair. Mayor, I just wanted to thank you and Ms. Carpenter and Dr. Vidal for your leadership on getting the teachers on board, and of course to the teachers who, this time last year we were talking about opening up. We were the first district and the only district of our size to be in school, and we did what's best for kids. So I see this, as you said, Mr. Mayor, I see this as an opportunity to show our teachers that we are a pro-teacher school committee. We have been, and we continue to be, and we value our teachers because we value our students. So I just wanted to thank everyone here for doing this, and as Ms. Carpenter said, wish the teachers and staff a tremendous and great year this year. Thank you.
Thank you, Mr. Mikko. Okay, a roll call vote, please, on the motion.
Mr. Hockman?
Yes.
Mr. Olympio?
Yes.
Mr. Amico?
Yes.
Mrs. Carpenter?
Yes.
Mrs. Dunn?
Yes.
Mr. Arnottis?
Yes.
Thank you, and I have one more. I'd like to make a motion to ratify a memorandum of understanding for Unit C, which is our paraprofessionals, for the 2021-2022 school year.
Second.
Thank you. You've heard the motion by Mrs. Carpenter, seconded by Mr. Olympio. Roll call vote, please.
Mr. Hockman?
Yes.
Mr. Olympio?
Yes.
Mr. Amico?
Yes.
Mrs. Carpenter?
Yes.
Mrs. Dunn?
Yes.
Mr. Arnottis?
Yes.
Thank you.
Great, thank you, Mrs. Carpenter. Okay, next subcommittee, school safety.
Nothing new to report.
Thank you, Mr. Olympio. Athletics and wellness.
Nothing
Mr.
new.
Notice.
Oh, thank you. Nothing new to report at this time, but I would like to schedule a meeting for 6 o'clock prior to our next meeting, or 6:30 if we're interested. I think there's probably a few things we can check in on and touch base. I'd be happy to do that if that is the will of my colleagues on the Athletics and Wellness Committee, but I'd be happy to book that.
Thank you, Mr. Arnottis.
Thank you.
Quality and standards, Mrs. Dunn. Oh, I'm sorry. On the athletics and wellness, Mr. Huckman.
Yeah, thank you, Mr. Mayor. Thank you, Mr. Arnottis, for scheduling a meeting for your subcommittee. If I may, through the chair, talk to Dr. Vidal. I know at our last school committee meeting, we had a robust conversation about middle school athletics. And as the school year is approaching, I was hoping Dr. Vidal might be able to give us a little bit of an update.
Yes, I have spoken with Mr. DeRoches, the new athletic director. He is actively looking for teams to play in middle school baseball and softball. It looks like cross-country is a go for middle school, and we're currently looking for some opponents. The Northeast Conference is not really open to middle school baseball in the fall, but we are expanding our search beyond the athletic conference and seeing if we can get a couple games for the kids. So we will provide another update. Once we get back to school, I'm hoping that we'll get some more takers.
Thank you for the update.
Great, and thank you for that question, Mr. Huckman. That's terrific. Okay. Quality and standards, Mrs. Dunn.
Thank you, Mr. Chairman. The Quality and Standards Subcommittee met this evening prior to this school committee meeting. Those present were the members, Mr. Arnottis, Mr. Olympio, myself, and Dr. Vidal. We received the information that has been provided, actually provided here in our packet as well, by the Mass Association of School Committees. It was a model boilerplate for mask policy, and in light of what has transpired today with the Commissioner and the Board of Education with the mask mandate, what we thought would be, we would come forward with a recommendation that the school committee just continue to recommend that, that the subcommittee recommends that the school committee and the district continue to follow our currently in place face coverings policy. It was really heavily researched last year with our Board of Health. They had great input and very good suggestions for it. On each of your desks is the current policy, and if you compare it with what MASC sent out, our policy follows everything in that recommended guideline. So it is the recommendation of that subcommittee that we continue to follow the current policy, which is EBCFA. It was approved last year, September 8th, 2020, and it's been in place since then, and we hope you will consider that. So I would like to make a motion that the school committee continue to follow policy EBCFA. So moved.
Thank you, Mrs. Dunn. You've heard the motion by Mrs. Dunn, seconded by Mr. Arnottis. Any comments? Roll call vote, please.
Mr. Hockman?
No.
Mr. Olympio?
Yes.
Mr. Amico?
Yes.
Mrs. Carpenter?
No.
Mrs. Dunn?
Yes.
Mr. Arnottis?
Yes.
All set, Mrs. Dunn?
Yes, just to let you know, we'll schedule the next Quality and Standards Subcommittee prior to one of the following meetings in September.
Okay, thank you. Parent and student advisory boards. Mrs. Dunn?
Actually looking forward to scheduling the first meeting with the Parent Advisory Board. Dr. Vidal, you will be an honored guest at that meeting. I'll schedule it with you at your convenience. It will probably be near the end of September so that the various schools are able to get their representatives elected. And it's always a really nice group to work with. I think you'll enjoy it.
Thank you, Mrs. Dunn. I know Dr. Chase is very much looking forward to her first meeting with the committee
Oh, that's
as
true.
well.
I'm sorry, Dr. Case,
Yes.
you'll be there too. Dr. Lord, you could come as well. The whole bunch of you, come on.
Thank you, Mrs. Dunn. Building and Grounds, Mr. Huckman.
Nothing to report at this time.
Special Education Parent Advisory Board, Mr. Olympio.
Nothing to report, but I will be scheduling a meeting probably for the end of September, live.
Okay, thank you.
We'll both have to coordinate with.
City Council and Legislative Delegation.
Nothing new to report, thank you.
Thank you, Mr. Arnottis. And Redistricting Subcommittee, Mr. Huckman.
Nothing to report now, but the summer is rapidly ending, and we'll be getting back to work.
Thank you. All right, any new business before we adjourn? Our next regular scheduled meeting is September 14th, 2021, 7 p.m. here again at the Higgins Library. I want to thank everybody for their work, and we're all wishing for the very best for this school year, so thank you for your work.
Yeah. And Dr. Vidal, thank you. Please tell the staff that the whole school committee wishes everyone a good year this year.